pandemic began that you and I have spoken. This is like a checkup.
Yes.
At first, we were just beginning to understand what was happening, and then we spoke in May as we were about to go yellow, and you were making the case that for people with chronic conditions who had been avoiding their doctor, it's time to go see your doctor. And now, here we are, and the numbers are surging again. How concerned are you?
Very. What we've seen over the last 3 days, especially Saturday and Sunday, we've seen the highest numbers ever in Allegheny County. One thing that we're seeing is that these are in younger people. So yesterday's numbers, about 77% of yesterday's numbers were actually in people under the age of 50. However, what we worry about is this the leading of the surge, where what we're going to see is these young, healthy people who have probably been out, have been socializing more. Are they going to bring this back to elderly people, people who are immunocompromised? What we've always seen is that there's the initial surge in numbers, even before you see a surge in hospitalizations and before you see a surge in deaths. And so what we're really worried about, although it looks good, it's young, healthy people that are getting this. Is this the beginning of a wave of people who are going to get sick from it? Is this a wave of people who, are we going to see more deaths coming? Are we going to see more hospitalizations? And so that's one of the things we really have to look at.
So when Allegheny County went green a couple of weeks ago, was it in the back of your mind that, boy, when we get to the end of June, after 2 or 3 weeks pass, we're either going to know if it's working or not?
It was. It was. I think everyone was kind of hoping that we were going to see the numbers continue to level out, maybe stay at, a low level of activity. And unfortunately, that's not what we're seeing. Right now, we are seeing these numbers are going up every day for the last week. We've seen higher and higher numbers, accumulating in today with the highest numbers we've seen since the outbreak started.
So what do you say to those voices, expert voices, who say, don't worry so much about the cases, as long as the hospitalizations aren't going up and death counts aren't going up, we're still okay?
Well, we are okay at this point, but we have to worry about, as the cases go up, there is that lag. Are we going to see, are we going to see more hospitalizations? Are we going to see more deaths? And
do you believe we are?
I think we might. It's only time will tell. But what we worry about is that if we don't start changing our ways now, we opened up, we started going out, we started seeing people and socializing. If we don't start cutting back on some of that now, and I'm not saying rolling back the openings that we have, but people have to be smart when they go out. They have to really consider the risks of going out. We're not in an area where things are back to normal, and we can't live like we're back to normal.
So if I said to you, hey, Brian, we're in green phase, how about I meet you at a restaurant today for lunch? What would you say?
No. At this point, I don't really think that it's worth it. And you really have to think about that. Is it worth it to see friends? Yes, we're all missing people. We're missing social interaction, but we're still in the middle of the pandemic. That's the one thing that hasn't changed. I think everyone got a little bit comfortable. We got a little bit complacent, and we're starting to see the numbers go up. And so at this point, if you can avoid these social interactions, it's still the best choice. That doesn't mean you have to be locked in your house, but you have to really be smart when you go out. You have to be smart when you're socializing with people.
I've been cooped up since the middle of March. How about I meet you for lunch, but at an outdoor restaurant?
A little bit safer, a little bit safer. Better yet, go to someone's house, stay on the back deck, stay on the back porch where you can stay 6 feet away from people and where you're not amongst other strangers who have the same plan that you do.
Are you going anywhere? And let me widen it out. Are you or any other medical professionals that you know going anywhere in public without a mask?
No, not at all. Not at all. There is nowhere that I would feel comfortable at this point going out without a mask on. There's no store, there's no restaurant, there's no bar that I'd be comfortable walking into without some sort of protection for myself and also for the other people that are in the establishment.
That's one of the questions that I've never felt I really understand. The message on masks since it evolved that we should wear them has been, you wear a mask to protect others, others wear a mask to protect you. But aren't I getting at least some protection from my own mask?
Yes, that is what the newest things are showing. There is probably some protection from wearing your own mask. You are limiting the spread of what you're breathing from other people. So there is the thought now is that you are protecting not only yourself, but protecting everyone else as well.
So let me ask you, I'm sure you're as engrossed in all of the evolving news coverage of this as the rest of us are. Is there any messaging out there that you think has been underplayed, has been mistaken, has been counterproductive? What would you put out if you could have the attention of everyone in Allegheny County right now?
I really think that it's that, there is this whole myth that it's summer. The virus is behind us. People aren't going to get sick, that young people don't have to worry about getting sick. It's another huge mistake. Young people can get symptoms. They can be sick. They can be hospitalized. More importantly, they can spread it to other people. The more people go out, the more they interact, the more this virus is going to continue to be out of control.
How many more days of increasing cases, new cases in Allegheny County can we have before we see some reversals, maybe returning to a yellow phase or, heaven forbid, the red phase again?
That's unfortunately what we're going to see this week. They are starting to have daily news conferences again with the health department, with the state health department. And that's something that I'm sure the governor and the health department are tracking very carefully. We were always told that if things get out of control, we will start to backtrack. We've seen this in Florida and Texas. Some of the earliest states to open up are now closing back down again. And so that's, what makes it even more imperative for people to really follow those guidelines, really think about what you're doing before you go out in public.
Let me just ask you again. I'm not sure I was recording when we talked about this before, but you're not seeing your own parents as often as you otherwise would still?
No, not at all. Not at all. I'm not seeing my family as often. I'm not seeing friends as often. There is some social interaction, but at the same time, when I do see my family, we try to keep social distancing. All of my family has been doing that. It's difficult. It's difficult not to see your friends. It's difficult not to see your family. It's difficult not to see people you care about. But in the long run, you have to remember you're doing it because you do care about them.
So you're not just operating that way because you're a physician and you might have higher exposure than others. You're saying that's appropriate for everybody.
That's appropriate for everyone, no matter who you are. One of the things I've always told people is if you do go on vacation and you're in one of these hotspot areas, you should be prepared when you come back to limit exposure to anyone for the next 2 weeks. Anytime you're in a large social event, you have to think, the payoff for this is if I am out with a lot of people, I really need to consider spending the next 2 weeks not socializing with people. When you have these, uninterrupted social events, weekend after weekend after weekend, that's where you're really going to start seeing, the disease spread. And so you have to kind of pick and choose what's most important for you for the summer. Is it a wedding coming up? Is it, a vacation coming up? And is that worth you knowing that you may have to spend 2 weeks afterwards in quarantine or staying away from other people that you care about?
They're going to play baseball. What do you think the chances are we're going to get through this shortened baseball season without one team having a whole lot of infections?
I don't think there's any chance at all. I really worry that we're going to anytime you have groups of people coming together, whether it's for work or for play, I can just imagine. We saw this in the basketball season and why it ended early. You saw, entire teams that were coming down with the disease. And so I think we're going to see the same thing in baseball.
All right. All good info as always. Anything else you want to add?
No, I think that was it. We just really wanted to get out there about making sure people, unfortunately, with the warm weather and people want to get out and they want to enjoy themselves and making sure they know that, they really have to make some tough decisions. They really have to limit some of the things that they're doing right now.
All right, a beautiful day, and for many, this is a vacation week, right? We're coming up on the 4th of July, always a crucial gut